Well, as you know, this is Foundation for Child Diabetes Awareness in Nigeria, where we are advocates for children with diabetes. The age demographic might be, or normally it would be from birth till about maybe 17 years, thereabout. So, but for today is World Diabetes Day. So it's an internationally recognized day for people with diabetes. So we are just marking today as a Children's Diabetic Foundation. And what we basically want to do today is just still to tell our children that, we care, we are still here, just a small gathering, small informal gathering. What are the obstacles they're facing? Where can we help if we can? And the theme for the World Diabetes Day for this year is breaking barriers and bridging the gap. Basically, just trying to close those obstacles and that they face every day, making healthcare affordable and accessible, and just advocating really for them. Because for children, they can't advocate for themselves, and the parents are just really, really exhausted. It is so much going on, So, want to do our little bit today, give out our little bits and pieces. We give out, maybe some insulin, we give out some test strips, you know, pay for screening at UPTH, where we partner with, now and then again. So that is basically what we're doing, our own little bits. This is you know, our head office for the foundation here. So we hope to be doing this even more regularly. We had our day camp, which you covered for us a couple of months ago. So this is just marking the World Diabetes Day. We have bigger events planned for next year. Big camps, big revolving funds for funding for insulin and medication. So this is just still just reminding them that we're still here. We haven't forgotten you. So that's what we're doing.
Yeah. Okay, Amia, statistics or some kind of maths from the last event you had to now, because that event was about diabetes in child awareness.
Yes.
Which was huge. I mean, that realization. So, what are you saying? Is a gap being bridged a little by that knowledge?
Yes and no. Now, why do I say yes and no? Yes, for us, because we now have access to more children that have diabetes, so we are kind of, we have a stronger database of what's going on. We have our little community where we reach out, where we post. We do post almost every day on, on our platform about healthy living, about medication, about this, about that. And we also have been able to reach out to a few to connect them with healthcare professionals that would, maybe ophthalmologists that would take care of eye problems, with our ill, medication, or we are broke, whatever we can do. So we now have like a bit more direct access. Now, why I say no is because from that time till now, prices of medication has gone up exponentially. So it is so difficult. Like I was just telling you now that, I purchased some, insulin and all that, just because I didn't want to take it to my house. I said, keep it in the pharmacy and they'll pick up. And I went to pick up to that. They said the price has gone up. I said, what do you mean the price has gone up? I paid for it already. And they were almost not giving me my insulin. I said, no, you're going to give it to me.
You had paid for it.
I already paid for it. I had my receipt.
At that rate.
Yes, that's right. So this is what we are dealing with. It's so expensive. A vial of an insulin pen, flex pen, is about 25,000 naira. If you're taking it as regularly as you should take it, you need like 2 or 3 of those in a month to keep you. How many people can pay 75,000 naira for insulin? How many children can pay? It is almost such a daunting task, but I don't want to give up and say, this one I can't do it, My little bit, maybe that my one insulin I give, pence I give, might save the life of that child for that week or that month. So that is what I'm doing. I'm just hoping that people will still help me, and then, yes, we'll keep going.
This insulin, what does it do?
Insulin brings lowers their blood sugar and health, because a lot of them children are type 1 diabetics. That means their pancreas are not even producing insulin. So this is like kind of like a replacement of the insulin in their body. Yes, that's what it does. So it's actually the lifesaver for type 1 diabetic patients. If you're type 1 diabetic, you most probably be on insulin. Yes.
Okay, this question can be off record, and then we can also publish it. So if people reach out to us, can we link them to you? Can we send them?
Children.
They won't be children that will come, like to be their parents.
With their parents,
But we
yes.
have, if they
Yes.
say,
Because the
yeah,
first, I always tell people, like, the first thing is to have somebody that will even listen. Do you understand? To say what is the problem? Okay. Oh, one child, the diabetes complications are setting in and all that. It's okay. Let me put you in touch with, screening and all that. I said, have you doing discounts from Foundation for Child Diabetes? So I beg, but yeah, maybe screening is 15,000 naira for screening because of screen kidney, A1C and all those things. But we say, like, you will help us now, let's pay 9K and so on and so forth. So that is where we advocate our kind of like bridge the gap as well. Yeah. So yes, we want as many because we need the data. We need to reach as many people as possible. We don't want situations where people are now doing alternative. I'm not saying though, but just doing alternative and children that can be saved will just die for lack of knowledge or lack of funds. So yes, please, by all means, they can. We're not afraid to take on or just accept only.
okay.
Yes,
So the last time your daughter shared her story,
testimony. Yes.
she shared her story. How was it taken? How do you think?
Oh, I think it kind of helped a lot of young champions, like we call them, and others seeing her and her journey and where she's at now. So yes, and she still advocates too, and she still reaches out to some of the children here, speaking with them, because apart from being diabetic, it's a mood thing too. Like there's depression, there's lethargy, there's so yes, she reaches out now and then again. I can mention some cases and say, oh, you need to call so and so because having a hard time. So she does that too. Yes.
All right, thank you so much.
Oh, you're welcome. And thank you so much.